Hi, this is Dr. Kurt Woeller for Integrative Medicine Academy. The title of this short educational video is Comparing the Organic Acids Test and Mycotoxin Profile with regards to mold and mycotoxin exposure. So we're looking at the top part of page 1 of the Organic Acids Test from Mosaic Diagnostics Laboratory. There are 4 markers that are indicative of Aspergillus mold exposure. That's markers 2, 4, 5, and 6. We can see in this particular case that markers 5 and 6 are both elevated. Arabinose is associated with mucosal reactivity with regards to gastrointestinal candida. So that marker is high. When that's high, that indicates that there is an increase in reactivity of candida along the mucosal lining of the digestive system. When we see elevations of 2, 4, 5, or 6, that is indicating exposure to Aspergillus, sometimes what's called colonization, although we do naturally have a little bit of Aspergillus mold in our digestive system as part of what's called the microbiome. It doesn't make up a significant percentage of the total organisms within the digestive tract, so an increase in one of these markers indicates that there is a abundance of that particular fungus. Now, this is the MycoTOX profile from Mosaic Diagnostics. We can see elevations of 3 medically significant mycotoxins. That's the ochratoxin, gliotoxin, and mycophenolic. Ochratoxin, gliotoxin come from Aspergillus mold, whereas mycophenolic comes from Penicillium mold. Now, one thing to keep in mind is that in this particular slide, this is just I'm showing again the organic acid test section we had just discussed. Tartaric is likely from Penicillium as well. There's evidence that it is clearly coming from Aspergillus exposure. Environmentally, Aspergillus and Penicillium molds tend to be found together, so they often coexist. There is some indications that the tartaric could also just be a product of the existence of Penicillium. So it doesn't really make much difference overall clinically or what you would do clinically, but just to be complete with regards to this particular discussion. Now, the other thing is to understand is that ochratoxin and gliotoxin come from Aspergillus. There is some evidence that gliotoxin can be produced by candida as well, probably not to the same degree that it would get produced by Aspergillus. And then we know mycophenolic comes from Penicillium mold. So all 3 of these elevated mycotoxins from Mosaic Diagnostics MycoTOX profile line up exactly with what we see on the organic acid test. So the combination of these 2 tests are definitely important. And one of the things I often advocate for is that don't use the organic acid test to rule out exposure to mycotoxins. You should also be doing the MycoTOX test. My recommendation as well, if you're going to do the MycoTOX test, also do the organic acid test so you get a much more complete picture. And we talk about this particular topic in great detail in our toxicity mastery course through Integrative Medicine Academy. We go through other topics with regards to environmental chemical exposure, glyphosate, heavy metals, mitochondrial problems. Yeah, we do a lot of discussion. In fact, 2 modules are dedicated to the topic of mold and mycotoxin exposure, laboratory testing, interpretation, clinical correlation, nutrient support, detoxification, therapies, etc. are all discussed within the toxicity mastery course. And like all of our mastery courses through Integrative Medicine Academy, they come with support documents. You get the lecture slides in a PDF format. There's course exams or certificate of completion. And then if you're interested in membership through Integrative Medicine Academy, make sure to go to the webpage and look at our IMA membership as well as mentorship options. So for more information about our mastery courses, through Integrative Medicine Academy, you can go to integrativemedicineacademy.com. Thank you.